So let's say good evening, everyone. I'd like to welcome you to our Advanced Practice in Ophthalmology Degree Apprenticeship MSc induction today. We'd like to extend a warm welcome to you from Rashmi Matthew and myself, Jay Varia, who are program co-directors. So what we'd like to do first is we'd like you to meet our program team. That's myself and Rashmi, and we also have Robin Stone, our Senior Teaching and Learning Administrator. Robin is a key part of this program. He looks after us, Rashmi and myself, but he also looks after you, and he will be your first port of call on our program. We'd like to introduce our module teams. So we have a medical retina team, and we're going to cover the modules later on in this presentation. We have our medical module leads for each specialty, as well as our non-medical module leads. Our glaucoma team, our cataract and principles of advanced practice team, our ocular emergencies team, our clinical leadership team, research methods, statistics, dissertation, and endpoint assessment. Team of one, so our lead. So degree apprenticeships, there we go. What is a degree apprenticeship? A degree apprenticeship combines a full-time paid work, part-time university study to offer you the opportunity to gain either a master's or a bachelor's degree whilst doing on-the-job training. They're created by partnerships between employers and universities, where the university provides the academic learning and the employer the work-based clinical learning on this particular degree. Degree apprenticeships are funded by the government, and they only cover the cost of the tuition through the apprenticeship levy. So all employers who have a wage bill of more than £3 million put 0.5% of their annual wage bill into a pot, and they can draw down on this to actually fund training. So who underpins degree apprenticeships? So there's an organisation called the Institute for Apprenticeships. They set a standard which actually details what the occupational profile is for a particular degree and all the learning outcomes. And the program is based on this standard. The quality assures this degree, they do, through their endpoint assessment organisation. The university has robust quality assurance as well as Ofsted. If you want to find out more about the standard, we've put the webpage down there for you, so you can look at it to get more detail about the standard. And what does it involve? So it involves on-the-job supported training for staff. So you can work, you can apply your knowledge, and your employer is fully engaged with training. Alongside that, you have a structured program with an academic component, which is run by the university. So your university runs teaching and learning, your employer runs the work-based learning, and we have something called tripartite reviews where the university, student and the employer have reviews to make sure we triangulate all your learning and make sure that you're getting the best experience. And the levy covers the training. So in a nutshell, that is what an apprenticeship is. What about our program? So the aim of our program is to provide the necessary skills and qualifications for you to take on advanced clinical roles in ophthalmology, in glaucoma, medical retina, ocular emergencies, and cataract. It's based on the 4 pillars. So we have clinical components, we have a leadership component, an education component, and a research component. So you gain the skill, the knowledge and skills of these 4 pillars. The program is developed by a clinician and is developed for busy clinicians or professionals like yourselves. The clinical education relates to practice. For example, case studies are authentic. All of the module leads are actually clinicians, they're advanced practice clinicians who work as part of their working week in clinics, and they actually work backwards. They take their cases and their teaching from the clinics and based on what you need to actually see patients safely. It is very interesting, and this is based on what student testimonial, challenging but very rewarding program. And at the end of this presentation, we've got one of our students to talk to you about her experiences on the program, managing work-life study, and what she does on the course. So you'll hear more from Shitali later. Right, so we've just got a little student testimony for you here from one of our students. And you can read that. Sorry. What's that? The structure of the program, it's a 3-year flexible program and it's fully online. So that enables you as busy practitioners to fit study around your work life timetable. We have frequent progress reviews between the university and the employer and yourself. And at the end of your study, there's something called the Gateway, which is run by the Institute for Apprenticeships. At the end of your study, you have to go through a gateway before you can sit the endpoint assessment. And I'm going to talk to you about this in a bit more detail now. So in your first year, in the first semester, in the first term, you have university learning. So we start you off here on a couple of on the introduction to advanced practice and a clinical module. You get some knowledge under your belt. And then in semester 2, you do some more work-based, you do some more university learning and work-based learning. So that's when the work-based learning starts. We then have a progress review, which is actually your assessments, they're your exams. And in semester 3, you carry on with work-based learning, which is purely done with your employer. In the second term, the first 2 semesters involve university and work-based learning. And we have a progress review at the end of that academic year. And then in the 3rd semester, you do work-based learning again. And this repeats in the 3rd year for the first 2 semesters. After the first 2 semesters, the Institute for Apprenticeships come in and they do a progress review. So they look at your academic work to see have you passed all your modules. They also look at your work-based learning and assessments. So when you do your work-based learning and assessments, you build a portfolio, and this is reviewed by your employer. We'll talk about this a bit later. And once all the work-based learning and assessments are done, and you've passed all your modules, and fulfilled all the other criteria that the Institute for Apprenticeships set up, you go through the gateway. Once you get through the gateway, you do your endpoint assessment, which is a 20 credit sort of assessment to finish at the end of the 3rd year. So the university-led part of the apprenticeship starts in September of the academic year and runs right through to January. That's your first term. And during that term, you have online learning and online assessments. From February to May, same thing happens again. You have online learning and online assessments. In June, we will hold practical skills days for those who want it. And then you go on to your 2nd year. But from May till September, you then carry on with your work-based learning with your employer. In your final year, the gateway happens in July and the endpoint assessment in your final year happens in September. The employer-led part of this training happens throughout your degree, right from the beginning to the end. Your work-based learning and assessments occur alongside your modules. So for example, if you're doing a glaucoma module, we'll expect you alongside learning that module at the university you would be doing work-based learning assessments in a glaucoma clinic at work. And that goes for all the other modules. The online component, it's the taught part of the course, covers the theoretical aspect, some practical techniques. We have self-test quizzes, forum activities, assignments, webinars. It's very clinical. We have lots of clinical case studies, lots of evidence-based learning. We teach you critical skills like how to critically review papers and apply the evidence to clinical care. And then we have the written assessment, which are predominantly for the clinical modules, multiple choice questions and patient management case scenarios. And with the patient management case scenarios, we expect to see clinical reasoning, application of evidence, so evidence-based clinical decisions. And our non-clinical modules are mainly essay-based. So what are our modules? So we have Principles of Advanced Practice, which actually talk to you about what is required as an advanced practitioner, and some of the teaching for that. We then give you a broad base with the clinical modules. You do fundamental glaucoma, fundamental medical retina, and fundamental ocular emergencies, together with principles of cataract. You then, after you've done your clinical modules, you choose to specialize in one area, either medical retina, glaucoma, and ocular emergencies, and do a specialist module in one of those areas. You'll then cover the other pillars: clinical leadership, research methods, and statistics. In your third year, your final year, you'll do a research report, ideally in your specialist area, write a journal article. So we'll show you how to do this, give you all the knowledge and skills how to do this, go through the gateway and do the endpoint assessment. And the endpoint assessment includes a clinical change project, which you will write about and present to a panel, and an open book exam based on 3 clinical case studies. So, other things to consider about this degree. So we have 3 frameworks: your ophthalmic practitioner framework, the OPT, and your work-based assessments can be used towards that professional qualification. We have the College of Optometrists higher qualifications, and you can use some of the modules for the glaucoma and medical retina. We don't run the contact lens qualifications. You can also get optometry CPD. So, in summary, we have 8 15-credit modules and a 60-credit research report, journal article, and endpoint assessment. What's the time involved? 1 credit is equal to 10 learning hours. So 15 credits. A 15-credit module is about 150 learning hours, and that covers everything: the online component, the face-to-face days, assignments, assessments, research, and self-directed study. So just to give you an idea of how much time you need to study this degree. And that is over 3 years, approximately about 12 hours a week. So Shatali can expand on that a little bit more. We expect you attendance and participation on this degree to be 100%. It's really important because the way the curriculum is set out is that you learn all the theoretical bits, but then when we have the webinars, you apply those theoretical aspects to clinical reasoning and clinical decision making when we present you with cases. So it's really important to actually gain the most from this. We have 100% attendance and participation. So let's talk about work-based learning. So we've covered that, which is the university-based learning. So work-based learning. So you examine patients in clinics relating to the academic modules. So we discussed that briefly. If you're doing a medical retina module, we'd expect you to do the medical retina work-based learning. You start in your first year, either towards the end of the first term, and we will give you sort of the competency sign-off sheets where you go into your workplace and you've got to see particular patients and ask your clinical supervisor to sign them off. Your clinic work ideally should be under supervision, and you build a portfolio. And you build this up over 3 years. Now, this work-based learning is organised entirely by your employer. Your employer signs a commitment statement once you've applied for the course to say that they will be providing you with the work-based learning as we set it out. So what they commit to is a clinical supervisor, and this is the person who is in clinic with you, and they actually observe what you're doing with your patients, and they are the ones who fill out the work-based assessment form. So as you're filling out your competency sign-off sheets, they're the ones who do it. There is a separate supervisor called an education supervisor. Education supervisors are actually the person who actually oversees your portfolio. So let's say you are doing a medical retina module, but you are not working in a medical retina clinic, or you need to have a placement in a medical retina clinic. Your employer needs to ensure that you have an education supervisor who will organise this for you and get your competency sign-offs. Your education supervisor should meet you on a regular basis to make sure you're getting those sign-offs. And if you're finding it difficult to get those sign-offs, they should be arranging clinical supervision or clinical supervisors for you to get those sign-offs. So these two supervisors in the workplace, which is organised by your managers, is really, really important. So the education supervisor, as we've said, they ensure that you get the most appropriate work-based learning, carry out the work-based assessment, and that you're progressing. If they find that you're not progressing in a timely way, that you won't meet the gateway, they've got to raise it with your employer and find a way to ensure that they accommodate work-based learning so it happens, so you meet the gateway. And at the end of it, when you meet the gate, when the gateway happens at the end of the third year, your education supervisor is the most important person there, because the education supervisor signs off your portfolio to say the work-based learning is done. That's a tick. We sign off as a university to say that your academic learning is done. So that's another tick. And then the third thing is you need to have GCSE English and Maths. So that's a third tick. And if those three areas are met, you then pass the gateway to then do the endpoint assessment. As we discussed, the clinical supervisor supervises you and does your work-based assessment, but most importantly, they give you feedback on how you're doing. If they find actually not doing so well, the feedback on the form, and then you've got to go back and improve and do that assessment again. Yeah. So, employers' duties. So they've signed a commitment statement, we've discussed that. They support you, but that's really, really important. And this is where this 20% off the job includes attending the course, includes attending induction, face-to-face days, workshops, peer review discussions, exam, and these are even when I say workshops, I mean the optional practical skills days, exam prep and assessments, self-study, completion of assignments, work-based learning and assessments. It includes all of that. So anything to do with this degree, apprenticeship, will be covered, should be covered in that 20% off the job. The university's duties, we have a duty to check in with you regularly, together with your employer or your education supervisor, to see if you're on track and what academic support we can offer. We also provide a portal or a way for employers to communicate with you or set up meetings with us if there are any issues. And it's the most important thing is to make sure that get quality assured academic teaching, learning and assessment. Tripartite meetings, we've discussed this, so it happens between yourself, the manager and the university. It happens 4 times a year. The first one happens about 1 to 2 months after teaching starts, and it's done remotely via Zoom or Teams or any other suitable remote communication. I mean, with regards to you as a potential student, student support and involvement is really important throughout your degree. So you either get a personal tutor or a tripartite tutor. So with this degree, they tend to be tripartite tutors. And it's a really, really important relationship throughout your journey. You also have the students support and wellbeing team at UCL. You can always, if you have any issues as a student that you need to discuss, whether they're experts in disability, wellbeing, mental health, if you just want to have a chat with them about how you're feeling, they're the ones to get in touch with. There's a student inquiry system and a self-help centre, and these are just support systems. But as a wider university system, there are plenty of societies you can get involved with. There's the wider student sort of experience you can have with student events, taking part in student initiatives. So it's not just the support we provide, but there's a wider UCL community you could also get involved with. We also make sure that you're involved in this program. So we have made changes to our program based on student feedback, so that it's continually developing in a way that's tailored to your needs, perspectives and experiences. So what we did was, students got back to us after our first academic year and said, well, actually, we need more live teaching or contact, and we incorporated that into our timetable. We can restructure the format of the program to actually tailor or actually provide more of what you need as a potential student. We have student reps who actually, it's a peer-to-peer support, gather feedback from you, they feedback to us. You can feed to them and they feedback anonymously to us. And just based on their feedback, they have, you have a say of how the day-to-day running of the program happens. So it's it's actually quite as a student, it's not just about teaching and learning, it's not just about your work-based assessments, but it's also about meeting other students. It's also about getting involved in the wider student community and networking and developing friendships, and that will take you through your journey. So I think I'm done here. So Rashmi, do you want to add any more to that? Before we move on, I'm going to introduce you to Shetali.
No, I wasn't going to add anything actually, Jay. I think you've covered it really comprehensively. I think maybe what would be good to do is hear from Shetali, who's one of our student representatives and who's on the course because she's actually dialing in from work. And then we've got a number of questions that have come through and we'll take those at the end. So Shetali, can I open the floor to you? And thank you so much for giving up your time to be with us this evening. So I'm going to let you introduce yourself. Lovely. And I was just going to ask you, Jay, to stop showing the slides. That's perfect.
Hi, everyone. Hope you can all hear me okay. So my name's Shetali. I'm one of the optometrists working on the MSc Apprenticeship program. I'm currently in my second year of the program. It's been really interesting. There's lots to learn. There's lots to sort of gain from the experience. I'm really enjoying it so far. It's just a bit of background. I work in a hospital full time, and I've been working in clinics such as glaucoma, medical retina, contact lenses and hospital refractions. And before I started this course, I was always wanting to know a little bit more about glaucoma or a little bit more about retina, and I just thought that I was sort of lacking in my knowledge in certain areas. And since I've started the course, I kind of feel that it's really nicely tied in with what I do at work. So that's the biggest benefit for me, because I just thought that I'm interested in these subjects or extended roles, but I just felt like I needed to learn more about them. And the good thing about the course is that it's really relevant, it's really current. There's lots of sort of expert speakers, and there's lots of face-to-face contact. Well, not lots, but I think there's generally, most of it is sort of distance learning, but there's definitely ways to communicate with the people who teach you, and there's face-to-face days, so all of that really works well. And the main thing is, like I said, just ties in really nicely with what you're doing at work. So if you are working in a hospital, if you want, you know, your long-term career to be in a hospital setting, or if you like eyes, it's definitely something you want to try getting into. There is lots of work, so we'll sort of get onto how I manage my workload, and everyone's different, so it's all about sort of keeping organised. So I do the glaucoma modules, medical retina, I've done ocular emergencies and cataracts. So I've done a sort of a bit of variety. And specifically, for example, with the glaucoma modules, I really find that when you're talking to patients in clinic, it helps you to sort of understand more about their risks and benefits for treatment. You start thinking about how you want to maybe escalate their treatment, or you think, okay, this person's on timolol and bimatopros, what should I do next if they're still progressing, for example? Do I have drop options, or should this patient, would they be sort of suitable for laser or surgery? And you understand all the theoretical knowledge about how or when you should be suggesting these things to the patient. So it helps to sort of communicate with the patients, as well as all your peers who you're working with, your colleagues, fellows, consultants, optometrists, whoever you're working with. So that really helps. And even with medical retina courses, again, I find that you get to learn about or different types of laser or different types of imaging, and when to use what. And you understand there's more to retina than AMD and DMO. There's sort of retinal dystrophies or so many different differential diagnoses. So that really helps too. And a nice element as well is sort of the research and statistics module that I'm currently doing right now, and also the clinical leadership. So they're not clinical modules, but they really help with learning about how to, for example, use the EndNote referencing software, or how to publish a journal article, or how to, just sort of how to understand about critical appraisal of journal articles. So it's all very evidence-based, and again, that ties in really nicely with when you're trying to explain to a patient about whether SLT, for example, is beneficial for them, because you know, or you've read about the current literature in that area. So that's really good. Leadership as well, you understand a bit more about your personality, or where areas that you can develop, and again, what it would help in the long term in terms of clinical leadership roles that you may want to sort of look into, or just developing generally as an all-rounded clinician. I think it really helps too. So obviously there is lots of study involved, and I think it can vary depending on the time of year. So obviously during exam time, there's definitely lots more study to do. But I think I've always found the good thing about the course is that it's very structured. So you know from the start of the year when your exams are going to be, you know when your deadlines are, you know when your assignments need to be handed in. So you can plan your year, say from September, you know exactly what you're going to be doing until the following May. So that's how it's sort of worked. And keeping a diary is the key thing. So, in September, put all your dates down in your diary. And so you know when things are due in, and so you don't miss any deadlines. Checking your emails regularly, things like that, which I'm sure we're all really good at, or I can still get better at it. I do get sort of half a day a week study time as well. So as part of the apprenticeship, you get 20% off study, which really, really helps. It's not enough. I think I still work a lot on evenings and weekends, but it definitely helps because you can use it for your study. So you can use it to revise, or you can use it to catch up on lectures. That's what I mainly use it for. But you can also use it for example, if you want to get experience in a clinic that you're not timetabled in for. For example, I don't do a consultant-led medical retina clinic, and I really want to do that. So I'm planning on sort of trying to observe in those clinics during my study time. And that hopefully helps me to sort of, learn and engage a little bit more and apply that theory into practice. You can also potentially use it for your own research or academic interests. So that really helps too. And yeah, I guess taking breaks really helps. So try and get a hobby if you can. I've recently just taken up swimming again, and that really, you look forward to those sort of non-study related things as well, and that motivates, I guess, and it helps as well. And just keeping in touch with the other peers. So we have like a WhatsApp group formed. We keep in touch with each other during, when everyone's got a deadline. You're not the only one. So although you can't, in these times we're not actually seeing people face to face, keeping in touch remotely, virtually, it's a virtual world at the moment. So that really helps too. So everyone's in it together. You're not alone. And if you do feel alone, then just reach out. There's, we get access to Moodle, which is the online learning portal. Everyone's emails are on there. You know exactly who everyone is. And yeah, I guess the best thing is just to learn and keep an open mind about it. But yeah, happy to answer any questions if anyone's got anything to ask, but that's what I wanted to say.
Great. So if you have questions, pop it into the Q&A. There are a few questions there already, which I'm going to start with. Shaitali, thank you so much. It's actually really interesting for us to hear a little bit more about your experiences too, as a student, and how you manage. So that's really lovely. So first question we have is actually for the programme. So thank you for all the details information. Within Scotland, I believe the funding is slightly different than the levy. Would you be able to provide more details? So the levy was brought in by the English government in 2017, but it does apply to all UK employers, even in Scotland. But in Scotland, the Student Awards Agency actually funding the levy. So actually, if you want to tap into the levy in Scotland, the best way to do it is speak to your employer to see how they can tap into it. So they do actually, it's run by a different agency, but you can still tap into the levy. One of the important things to actually point out here, if you want to use your employer's levy to do this degree, the first thing you need to do is talk to your employer, and all big employers will have an apprenticeship manager. So you've got to get approval from your apprenticeship manager and the employer before you actually apply to us, not the other way around. You wouldn't apply to us first and then you talk to your employer. So that's really, really, really important to note for the degree apprenticeships. So your first port of call is your line manager or your employer and the apprenticeship manager, and then you apply to the university. So I'm an ophthalmologist with some experience in my home country. Is this program suitable for me, and can I get it over 1 year? One thing is, I don't think this is suitable. It's an advanced practice degree, so it's more suitable for non-medical professionals like optometrists, orthoptists, ophthalmic nurses, personal ophthalmologists. But there is a degree at UCL, which is MSc in ophthalmology, which you could actually do.
I've just put the link for MSc ophthalmology in the question. And just related to that, Haneen Alali has asked, is this program suitable for doctors who finish residency? How is the surgical experience? And just really to say that none of our master's degrees provide any surgical experience. And if that's what you're looking for, then probably what you want to do is look into a fellowship where you would be able to get clinical and surgical experience.
We have another question I saw in the chat. Is a scholarship available for Pakistani students? So this degree is only suitable for UK-based students, and not anyone who doesn't have working for a UK employer. But actually we do, as Rashmi's put into the chat, we do have a scholarship that can be used for our parallel degree, which runs alongside this degree, which is a non-apprenticeship degree. So we do have a non-apprenticeship degree which is not attached to the levy for UK-based optometrists, but you need to be working for a UK-based employer that has access, who has access to the levy. So, yep, and then we have another question. Would this course accept biomedical BSc degrees at entry requirements? Not really. You'd need to be a clinician and have some clinical experience under your belt. And then, are you able to gain accreditation for both OPT and the college? So the accreditation, so the work-based learning and assessments are based on the OPT and can be used towards the OPT. So you can APL it. So it covers most of the level 3 OPT sign-offs, but you'd have to register with the Royal College of Ophthalmologists, and you can use the sign-offs that you get from this degree towards that qualification. You may need to do a bit more for them, but you will definitely get the level 3 sign-offs. With regards to the College of Optometrists higher qualifications, the module itself, the academic module, covers the academic component of the College of Optometrists higher qualifications. By doing the work-based learning and assessment, you will be covering the placement component with your employer for the College of Optometrists higher qualifications. But outside the program, you'll have to do one more exam. You may have to do OSCEs and VIVAs outside the program to get the full qualification. So it gives you, you can use what you have in the MSc towards these professional qualifications. Yeah, Chris, so that's it. Yeah.
Just also, if I could just say, so Mohammed Shabazz, you asked about degrees for Pakistani students. I've also just put into the chat our advanced practice in optometry and ophthalmology MSc link. So it's the parallel degree program that is for international students. And we do have 5 international scholarships for excellence. And I've given you the link for both of those there if you wanted to apply. So those are in the chat box.
Another one about how about Ireland? The levy does cover, I mean, again, the levy does cover Ireland. What I don't know is whether, like Scotland, there is a separate agency that actually runs the administration of this levy. So best check with your employer first. And would this program and all the advanced practice optometry ophthalmology be appropriate for an MD prior to completing residency? Would like to do an MSc with distance learning. I don't know.
Yeah, I was just going to say, so again, if you're looking to do ophthalmology residency and you're a doctor, then really you want to be looking for the MSc ophthalmology program, and I'll just give you that link again. So I'll just pop that into the chat for you. Your question's just moved. There we are.
So do we have any questions for Shatali? What it's like to be prospective students on the program? Shatali, I have one for you. What's your top tip as a student if you're going to give advice to other students, you know, you're doing this degree over 3 years, what's your top tip to other students?
I think as you're going along, as I said, just keep a diary, make sure you know exactly what's happening. But I guess the top tip would be just remember, sometimes it can get tough, and you know, I'm sure lots of people have done previous study before, degrees or whatever. It's always a task trying to keep on top of things, but just keep faith in yourself, I think, and know that you can do it, and remember why you chose to do it, and remember the end goal. And I think that's what helps.
Oh, great, thank you. Thanks, Shatali. That's really helpful. All right, I'm just looking at the messages. Yeah, and if you look at the chat box, Rosie's put some information about the scholarships, which could be used towards our parallel degree, and Rashmi's put the link into the chat. Yeah, I think we've covered everything in terms of questions, unless there are any more questions. Rosie, it's over to you then.
I think just if I may just say one thing, and I think just speaking to our students, what's very clear to me is actually how much the MSc program actually helps our students in their day-to-day clinical practice, and they really kind of learn the knowledge, the skills, the behavior, the research as well that sort of underpins day-to-day clinical practice, and really how quickly also our students start to feel that benefit in their clinical practice. And I think that is you know, really heartwarming to have those conversations with our students when they talk about the benefits that they're seeing and how they see those so quickly. And what's also wonderful, I think Shatali also touched on this, is it's not just about the clinical aspects, but actually because it's an apprenticeship degree, we actually you know, teach on the other pillars, so clinical leadership and research as well. And so so actually you're being supported in lots of different ways to take on advanced practice through the degree. So I just wanted to sort of highlight that point about the MSc degree apprenticeship program.
We have a couple of more questions.
Oh, let's have a look. Is there a deadline for the next round of applications? Is there continuous admittance? So from what I understand, our deadline, I mean, there's a deadline for the end of March, but we may have a second deadline for the end of May. So it's a good time to actually get the ball rolling now with your employer and the apprenticeship manager, because that can take a bit of time. When you're applying, just remember the application form. You need to have a couple of referees as well. And you'll have a personal statement to fill out. So do allow some time to fill out the form as well. Do you accept any other accreditations to count towards modules, previous IP optometry modules? At present, because IP is not part of this curriculum for this MSc, we don't accept it, but we do accept for RPL if you've done previous College of Optometrists higher qualifications. So if you've done glaucoma medical retina higher qualifications, you can actually RPL that onto the program. When can we expect admissions decisions? So once it goes through to our general sort of central UCL admissions, it's processed. What they do is they just make sure that all your forms are fine, and we've got your maths and English. So dig out your maths and English results, because that's what students find takes the most time, as well as your referees. It's then sent to us. We turn it around fairly quickly, and it goes back to the general admissions. Sometimes if general admissions have a backlog of students, it could take a little bit of time, but you should have an answer fairly swiftly. Do we have a link to the research degree in ophthalmology? Yeah, we could send that to you.
So I've just put a link just in answer to Selma's question for all the programs. So actually you can go onto the program pages and just see which program suits you most aptly.
Yeah, our institute website has talk programs and research programs as well, so you just have a browse. So yeah, if you have, I mean, Rosemary's put in the chat, so if you have any further questions, or you can always contact us at io.pgt@ucl.ac.uk and we'll get back to you.
Oh, we have one more question that's just popped in the Q&A.
Yeah, that's fine. So clinical nurse specialist specialising in ocular plastics, doing both clinics and minor ops since I got the new job last year. I need an MSc to support my job role, but is this course enough considering ocular plastics is not included in the options? It depends on what you want to do. So we don't cover ocular plastics advanced practice in that specialty. It's glaucoma, medical retina, ocular emergencies and cataract. So if you want to do ocular plastics, we don't actually do that for this particular degree. But it's a good way to get into other specialties if you want to.
And just also to say, if you are interested in our nursing program, Maria Hazel, it's on the links that I've just shared. So that may be a more suitable route for you, and you might want to explore that. We've just got a message from Emily just saying thank you so much for the information, so helpful and perfectly timed. So I'm pleased, Emily. Thanks very much for your comments.
Great.
Are there any other questions from anyone?
I'll just give it a minute in case somebody's typing away. But thank you all for attending. It was lovely to inform you about our degree. We're all very passionate about it. And if you're interested, we look forward to welcoming you on the programme.
Yeah, and just to say a big thank you to Shatali for coming out of clinic. So Shatali's just stepped away from her patients to just come and be with us this evening and just share her experience. So thank you very much for doing that, Shatali. It was really great to hear about how you're getting on and how you manage work life and study life, and also just kind of the benefits that you're experiencing from the program. So thanks so much, Shatali.
No problem. Thank you. Good luck, everyone.
Great, thanks. Brigitte has said, thank you all for this session. It gives us a lot of insight. I'm looking forward to joining this program. Looking forward to meeting you too in September.